Okay, thank you very much for joining us. I'm Donna Cooper. I'm the Executive Director of Children First. We are an advocacy group that is working to improve the lives of children across the state. We're an independent voice for children, and we work very hard to make sure that we can build bipartisan support behind the clearly most bipartisan issue where people can find agreement, which is on policies that affect children. Today, we're talking with you about how Pennsylvanians view paid leave. And what paid leave means is when a mother has a baby, when she goes home from the hospital, is she given time off with pay to bond with her child? And the same goes for the father, so that they can build that close relationship with the child that really research shows is so important to those sort of intimate relationships that parents need to have with their children. And one of the things that paid leave offers is really choice for parents. Parents of means or parents who work for large employers in Pennsylvania, they have the option or the choice for how long they can stay home up until their pay runs out. So for instance, if you work for a big bank in Pennsylvania, you might be getting 12 to 16 weeks of paid leave. But other parents don't have that choice because they're working for employers that can't afford to offer that kind of benefit. And so what's happening across the country is more and more states are stepping forward and creating a level playing field for all parents. So all parents can have the same choice to meet the needs of their children or a sick family member, by the way. And so that could be an aging parent or a very sick child. And what we're here to discuss today is how do Pennsylvania's voters feel about that? And we chose to look at how Pennsylvania Republican voters are feeling about that, because it's very important to understand where voters on each side of the aisle really come down on this issue. And national data has always presented a pretty strong near consensus among Democratic voters that paid leave is an important thing for every parent to be able to expect to have to bond with their baby. It's a pro-family policy that's long had Democratic Party support. And what we're here today is to find out what Republican voters in Pennsylvania have to say about this. And it's my pleasure to introduce Mark Harris from Osage Polling to talk with us about that. Mark is based in Western Pennsylvania, has a long history of examining how Pennsylvania voters feel on a lot of issues, consulting with some of the top Republican popular candidates in Pennsylvania, like Senator Toomey, and also small efforts like this, which are policy driven. So it's not a campaign, but a policy driven effort. And we're really excited to hear from Mark today because of his intimate knowledge of the voters that we're seeking to learn from and what their views were. So Mark, we'll turn it over to you.
Absolutely. Thanks for having me today. I put a few slides together if we can get those up, but briefly, again, my name is Mark Harris. I've done a ton of survey research for Republican candidates at all levels. And one of the things that we always like to do is look at where the policy implications are for folks. So we did a survey here of Republican primary voters across the state. So we did 500 Republican primary voters. So the margin of error is a little more than 4. And we went and made really looking at what a statewide primary electorate would look like. So, we asked a series of questions, but the main question that we're going to spend most of the time today talking about, and again, this survey was done in January, so, very recent data, is really about the support and the broad-based support. I mean, to put the bottom line up front, we'll get into this, but sort of all demographic groups that you can think of inside the Republican Party are supportive of paid family leave. So we did ask the question, would you support or oppose establishing a state family and medical leave fund in Pennsylvania to provide workers with paid leave after the birth or adoption of a child, or to care for a family member, or to recover from a health condition? Again, just Republicans that we were talking to here, 60%. So, well over a majority, almost 2/3 of voters support this policy. And in fact, 37% strongly support the policy. So again, a broad base of support for this inside the GOP. And we'll get into more details. But, certainly if you're looking for sort of the top line up front, Republican voters are supportive of paid leave. We can go to the next slide here. So we can look at a few key groups. The first, and this is increasingly important in Republican politics, is the education gap. I mean, the Republican Party is increasingly a party of working class voters. And you'll actually see here that the support for paid family leaves actually increases with with voters without a college degree. So 56% of those with a college degree support the policy, but 64% of those without a college degree. And that's really the heart. And if you look at sort of the Trump and the populist base inside of the GOP, it largely lives with those non-college voters. And so, again, you see this intensity of support inside even, what people might assume is it might be the hardest area for these sort of policies. In fact, this is the area inside the GOP that has the most support. White voters, 61%, non-white voters, 55%. Women voters, pointing out 2/3, 67% of them support the policy, but even men, 52%, so a majority. And so, again, these are the types of level of broad-based support that's rare to see in politics today. I mean, oftentimes, almost any issue that we test, it's very evenly split. So to see overwhelming support inside the GOP for this policy is, something that I think really adds a bullet point to the level of support here. We also asked the question, sort of, do you consider yourself a part of the traditional Republican Party, the Donald Trump Republican Party, or the conservative movement? And, one of the things to note is Donald Trump Republicans, again, they're not the majority of the party, but they're a large group inside the GOP. 63% of those support the policy. People who self-identify as traditional Republicans, 74% of them support the policy. And even among sort of this conservative movement Republicans, which is largely the furthest to the right group inside the GOP, you're still at basically half of them being in support of the policy. And so, again, wide both breadth of support, but also depth of support in very key groups, which is encouraging for this issue. I mean, again, this is an issue that is popular with Republicans, popular with Republican primary voters, and supporting it from a political standpoint really has, no sort of electoral downsides. In fact, lots of upside. We can go to the next slide. So one of the things, we looked at regions. You can see that there is a broad support across the state. So in the Philadelphia, this is by media market. So in the Philadelphia media market, which in a Republican primary is roughly about a third of the total vote, 61% support, 35% oppose. In the Pittsburgh media market, and this isn't just I want to stress, this is not just the city of Pittsburgh. This is Allegheny County and about 11 surrounding counties that are inside the Pittsburgh media market. It's about 22% of the vote in a Republican primary. Overwhelming support, 68 to 27. The Harrisburg media market, it's usually about a quarter of the Republican primary vote, comes out of the Harrisburg market, 55 to 39. Wilkes-Barre, this is the closest it is, but even still 49-41 in the Wilkes-Barre market. Johnstown 76 to 17, Erie 76 to 35, and the sort of scattering of 3% of the vote that comes out of other 40 to 47. That's a very small sample size. So I would take a little bit. I'd take basically the Wilkes-Barre, Johnstown, Erie, and other with a little bit of grain of salt because you're getting into, very small subcells. But again, you can see geographically a wide breadth of support across the state. It's not just concentrated in the urban or the suburban areas. Rural, throughout the state, you see, high levels of support for the policy. We can go to yep. So, we asked several messaging questions to really get at what was driving the support so that we could really analyze why people felt this way. So one of the things we asked was that family and medical paid leave would allow family members to provide critical care and rehab services to elderly loved ones at home without risking the jobs and financial security. And this is, to us, was, one of the key positive messages that came out of this. So Among moderate to liberal Republicans, again, you see over 70% support because of this message. Somewhat conservative voters, low 60s, very conservative voters, mid 60s. So again, that very conservative group that one might assume is one of the harder groups to get involved in this still sees overwhelming levels of support. People in the Trump movement, people in the conservative movement, and traditional Republicans all above 60%. In fact, traditional Republicans above 70%. This message really does move people to be supportive of the policy when they think about the implications of having the ability to care for loved ones when they need it as part of the paid family leave package. We can go to the next slide. We also tested a pro-family message, really that family and paid leave is a pro-family policy that helps families to take care of each other instead of the government. So really we were trying to, talk in the language that Republican primary voters are, they themselves talk in. And again, we see large levels of support. Trump movement in the high 50s, conservative movement in the high 50s, traditional Republicans in the mid 70s. Again, huge area of intense support among the traditional GOP base. Very conservative voters, almost 60%, somewhat conservative, almost 60%, and moderate and liberals, a little over 70%. And, basically in a Republican primary, very conservative voters make up about 50% of the vote. Somewhat conservative voters make about 25% of the vote, and then moderate and liberals combined make up about 25% of the vote. So it's, while they're not obviously the majority of the GOP, moderate and liberals are an important subgroup inside the Republican Party. So, again, as I started with the sort of top line up front, the too long did not read message here is really there's strong support for paid leave amongst all key Republican groups, college educated, not college educated, men, women, very conservative, somewhat conservative, Trump, not Trump, all of them are supportive of paid family leave. And voters see that providing care to family members and the sort of pro-family messaging is really important and is persuasive to them. And there's no political harm, in fact, really only upside to being in favor of this policy that has a breadth of support across the Republican Party from east to west and upper income to lower income, conservative to moderate. Republicans want paid family leave. So with that, yeah, I mean, that sort of covers the messaging that we've done, and, appreciate everyone's time today.
Mark, thank you so much. That really crystallizes why we are trying to have this conversation today, because so many family members need the time to get off of work where they're not risking their job or financial security to take care of loved ones, to provide critical care to loved ones, including themselves to the extent that they are pregnant and they're trying to take care of themselves and their babies. So we're going to talk a little bit about this going forward with Caitlyn, but I do want to remind people, why are we having this conversation today? In the Pennsylvania House and Senate, there will soon be bipartisan movement to surface a bill to make Pennsylvania join the League of States, 11 states that already are administering paid leave programs. That does not mean that the government is paying for these programs, but it means that the government's creating an environment in which every parent has the choice to keep their job, maintain their financial security, and care for a loved one. And so that is why we're talking about this. And we're also talking about it because the most of the surrounding states around Pennsylvania already offer this kind of system for the people who are working in their state. And so I'm going to ask Caitlyn Householder, who's from Ellwood City, to talk with us today, because she has a particularly poignant experience where being on the border of Pennsylvania really raises a question about what it's like to raise a family here and whether we have strong enough pro-family policies. So Caitlyn, I'd like to thank you very much for joining us today, and maybe say a little bit about who you are and why you're speaking about this today as well.
Hi, so my name is Caitlyn Householder, as was stated. I am currently 30 years old. I have a son of my own who's going to be turning 3, and then I also raise my stepdaughter who is 11. I found myself being diagnosed with cancer at 26 after months of fighting for answers as to why I was in debilitating pain. I had worked 60, 70-hour weeks. I was healthy most of my life, even though I was, overweight, but I had no medical, problems that would even lead up to me thinking that I would be diagnosed with cancer at that young of an age. I went through needle biopsies and I ended up having to quit my own job because they were refusing to work with me around, time off. And my husband was fighting with his job to be there for days because he works in the oil field. So he has kind of an odd schedule where he's, working 2 weeks straight. He's off for a couple days and then that just continues. So it was very hard to go through all of these doctor's appointments whenever, he's working sometimes states away, New Mexico, Texas. So we ended up starting treatment. And when I went in to start treatment, I got told that after 5 years of infertility, I was now pregnant. So not only did I have cancer, now I had all of these OB appointments that I had to go through. We had to make a decision. It was just kind of a whirlwind of months. And this happened right before COVID came to the US and then the pandemic hit. So then you had all of these unknowns. You couldn't take off of work because you didn't know if you were even going to have a job come the next day. My husband did not have any FMLA really protection. He was able to take it, but it was unpaid. Most of his money comes from bonuses, which has to be earned from working. He makes very little on his salary, so he would have still got his salary, but there was no protection into what actually pays our bills. So thankfully he was laid off during COVID, and we were able to get assistance obviously through, all of the COVID packages, but not having any protection whenever he did go back to work towards the end of 2020 really left us in a hard spot because I had over a month of radiation treatments every day that he wasn't able to be there for. I had to take my newborn son and my 11-year-old, then 9, with me every day. Somebody had to meet me there, sit with them in the car because obviously you were under protections with COVID that you couldn't have any visitors in the buildings. So nobody was there to help. And having, paid family leave to where he could have chose to still be at home with me and helping really would have made it, a lot easier on everybody. That's kind of why I started supporting the paid family leave, because I am a Republican. So that is, why I'm here, because I am a living person that shows that that study is correct. We never thought in a million years that I would become disabled at 26. It really put into perspective how much the state is lacking in, family leave, family, protections, even just straight disability. I've talked to many other states, and their protections, their cares, their financial assistance for when things like this do happen are a lot greater than PA. So that's kind of why I support it, because it definitely hits home. I've had to not have my husband there when I was in the ER and they thought I had a blood clot. So I definitely support 100% having some type of paid family care.
Thank you so much, Caitlyn, and for sharing your experience. And I mean, it's good to see you. Like, obviously, cancer is not taking you down, and you're still there to raise your children and be a good mom. So look, what we want is good, healthy moms and good, healthy dads and good, healthy children. We need parents to be able to take care of each other during post-pregnancy and also in illnesses like this. If Caitlyn was living in New Jersey or New York or Washington, D.C., or Connecticut or Delaware, very nearby locations, these issues would have been remedied by the fact that their states have programs in place that are pro-family, that enable people to take care of loved ones when a crisis, a medical crisis hits. So thank you very, very much. One of the things we want to point out is that the opportunity before Pennsylvania is something that would enable hardworking families like Caitlyn to keep their jobs, to keep their income, to keep them off of any being reliance on public benefits in the future, because we have sustained their ability to take care of their loved ones during a medical crisis. So this is a really, smart policy that, interestingly, Donald Trump embraced wholeheartedly when he was the president. During COVID, for the first year of COVID, the federal government, in fact, underwrote paid family medical leave for parents across America, because we understood the critical nature of making sure that if somebody was having a baby during COVID, somebody needed to be with that baby afterwards, and there wasn't able to leave the house. So we learned during COVID how important this is. So Caitlyn, thank you so much. And I hope your kids are healthy and doing well. And so with that, I do want to say that Caitlyn's experience is pretty pronounced compared to, like, when you think about this issue and the Western PA data from the Pittsburgh media market, the Erie media market, and the greater Johnstown media market. Those tend to be more rural parts of the state. Obviously, Johnstown and Pittsburgh and Erie aren't, but around them in those big media markets, they're more rural. Now, rural Pennsylvanians have a much longer commute to work. So they travel 3.8 times as far to go to work than somebody in an urban or suburban community. What that means is their time away from their baby or somebody sick is longer. It means, for instance, in Caitlyn's case, that going to the, maybe not in Ellwood City, but in a rural community, going to a hospital for treatment, taking care of your baby without somebody supporting you is very complicated because of the far distances that people have to travel. Also, rural voters in Pennsylvania are less likely to be working for an employer that offers paid leave. So when you think about who does offer paid leave in Pennsylvania right now, large banks, large healthcare systems, large insurers. So most of your small manufacturing, most of your small businesses, independent retailers, they're the people who are unable to currently, under the current system, make sure that they can keep their employees, because they don't have the bottom lines that can support it. So the jobs that are most prevalent in rural communities are the very jobs that are least likely to offer their parents paid leave. In addition, rural residents are more likely to be working part-time. And so that means that they're also working for employers that, because of scheduling, they're not on the full benefit package of, let's say, Amazon or a Walmart, and therefore they're not tripping into their full benefit package. So without a state leave program, in spite of the fact that they may want to work full-time, they may not have access to full-time work, and therefore they don't have access to paid leave when they need it. So we want to make sure that the parents in rural Pennsylvania, parents who are Democrats and Republicans, know that they can live in a state where the needs that they have to care for a loved one in a critical crisis, a medical crisis, are taken care of. And so I want to thank Mark Harris and Caitlyn for being here with us today. And I just think the big takeaway here is that the strong Republican support among the subgroup of Republicans that see this as an opportunity to demonstrate to their constituents the importance of taking care of your family first is what we're really seeing and hearing from families across Pennsylvania, regardless of party. So thank you very much. And we look forward to having more conversations with Mark, parents like Caitlyn and Caitlyn herself over the months ahead as we talk with lawmakers about advancing this policy. Thank you very much for joining us today.